This meeting is being recorded.
Hello, this is Dr. Morris. I'm doing an exam review for Exam 3, which covers the axial and the appendicular skeletal systems primarily. I believe that covers chapters 6, 7, and 8. Please refer to your syllabus for the specific chapters to read, page numbers, and assignments. Excuse me, I'm a little hoarse today. I'll go ahead and start with the lecture portion of the exam. And then when I get to the review for the lab portion of the exam, I will share the desktop because there are some illustrations and slides that I do want to show you. Again, because it covers the skeletal system, some items you should be familiar with. You should understand what the role of vitamin D is, what the role of calcium, and also the role of vitamin C is in the skeletal system. Particularly how these particular supplements are important for the treatment and or prevention of osteoporosis. You should be familiar with some of the cell types in the skeletal system. These include the osteocytes, the osteoblasts, and the osteoclasts. You should be somewhat familiar with the osteoprogenitor cells. Remember, you should also know which of those cell types are the most abundant cell types that you see in the bone. Again, you should know the primary role of vitamin D. Remember, vitamin D is responsible for the absorption of two electrolytes, and you should be familiar with the process involved in that. Just the basics. You should know the electrolytes. I'll give you one, calcium. You should know what other ion is a part of that as well. But vitamin D is very important, and you should understand its role. You should know the difference between an open and a closed fracture. You should know the term compound fracture, what that means. You should know the difference between long bones, flat bones, sesamoid bones, the different bone types. You should be able to give me several examples of long bones in the body. You should be able to give me the definition of a foramen and why foramens are important in the bones. You should be able to give me the primary function of the skeletal system. It has several roles, and you should be familiar with that, some of which are structural, of course, support, but there are some other processes that bones are responsible for as well, and you should be familiar with those. You should be familiar with the following terms: lacunae, caniculi, and osteon. You should be familiar with the term osteopenia and osteoporosis. You should be familiar with the definition of ossification. There are also some other terms that are used as well: calcification and osteogenesis. Should be familiar with those terms as well. You should be familiar with the term Colles fracture, the term pot fracture. Should be familiar with the term green stick fracture. You should be familiar with the disease process of rickets. See this in childhood. You should know the symptoms that can be observed, the signs that can be observed in a child that suffers from rickets. You should be familiar with the role of calcitonin, the role of growth hormone in the metabolism of bone or the process of bone. Should be familiar with what elevated calcium levels or calcium ion levels in the blood, which hormone is stimulated by this. You should be familiar with the term diaphysis and metaphysis, and the term epiphyseal plate, and the term epiphysis. I'll repeat those: diaphysis, metaphysis, epiphysis, and epiphyseal plate. Should be familiar with those terms. You should be able to identify the different portions of the human skull. Should be able to identify some of the landmarks of the human skull. Should be able to identify the suture lines. There is a major foramen in the occipital bone referred to as the foramen magnum. Should be able to identify that and locate that. You should be able to give me a good description of the sacral bone. Remember, this is a fused bone. Should be able to give me a good definition of the coccyx bone. You should be able to give me a good description of those two bones. Exactly when does the fusion occur? The differences between the male and the female pelvis. What muscles, and generally what muscles. I mean, I know it's a lot of muscles that connect to those bones, but generally it's responsible for some of the pelvic muscles that are very major. And you should also be familiar with the differences between the male and the female pelvis. I may have already said that earlier. You should be familiar with the term alveolar processes. Alveolar processes. Alveolar processes are in the mandible bone and also in the maxilla bone. Should be familiar with the function of those processes. Two bones are important in the cervical. Well, all the bones are important, but there are two particular bones in the cervical spine that you should have a good knowledge of and a good description of. This is the atlas and the axis, C1 and C2. For gesturing of the no response or gesturing of the yes response, you should know how those two bones interact. Be familiar with that. There are 7 cervical vertebrae. You should be familiar with that. And you should be able to give me a good description of the cervical vertebrae. The cervical vertebrae differ in number and in structure from the thoracic vertebrae, which both the cervical and thoracic vertebrae differ in number and in structure from the lumbar vertebrae and the sacrum and the coccyx. So you should be able to give me a good description of each of those different type of vertebrae. Obviously, I'm going to ask you to identify those and their various parts when we get to the lab portion of the course. But for the portion of the lecture, you should be able to identify a good description or some particular types of landmarks on either of those bones. You should be able to tell me how many cervical bones, how many thoracic, and how many lumbar bones exist as well. You should be able to give me the difference between the appendicular skeletal system and the axial skeletal system. Should be able to give me a basic difference between the pectoral girdle and the pelvic girdle. You should be able to give me some distinctive features of the ribs. The ribs articulate with the vertebrae. Should be able to tell me what vertebrae they articulate with and where they articulate with the vertebrae. You should be able to give me some distinguishing characteristics of the thoracic vertebrae, particularly because of this articulation with the ribs. There are some specific features that you see on the thoracic vertebrae that are not on the other vertebrae. Should be able to give me the definition of true ribs, where the true ribs are located at. Should be able to give me it should be able to give me a good description of the femur. The femur has several key landmarks as well. Remember, this is an example of a long bone. It has a articulating surface superiorly and an articulating surface inferiorly, and some specific landmarks that you should be able to identify. It's the longest and heaviest bone of the body. You should be able to recognize that. You should be able to give me similar features of the clavicle. Clavicle articulates medially and it articulates distally or laterally as well. You should be able to give me the points of articulation of the clavicle. You should be able to give me a good description of the fibula and the tibia. There are some prominent landmarks noted both laterally and medially, inferiorly and superiorly in these bones. Should be able to identify those landmarks by description. You should be able to give me a good description of the surface features of the ulna and the radius. Should be able to tell me in anatomical position which of those two bones would be medial, which of those bones would be lateral. There is a condition referred to as flat feet. Should be able to describe what is meant by the term flat feet. what particular bones and ligaments are involved in the creation of flat feet. There's a disease condition referred to as giantism. Should be familiar with that disease and be able to give me some basic information about it. Should be familiar with the importance of phosphorus and calcium in the body, their role, especially in the skeletal system. There is a hormone referred to as calcitriol. Please explain what the importance of that hormone is. Explain where the production of that hormone first takes place. I believe I may have asked you this already. If not, the epiphyseal plate. What's the importance of the epiphyseal plate? What's the importance of its role? You should be able to describe the spinal column, beginning superiorly and moving caudally. You should also be able to describe to me what is meant by the term paired and unpaired bones. For example, the nasal bone, the palatine bone, and the maxillary bone are paired bones, meaning there's a right and a complementary left portion of those bones. So that's a paired bone versus like the vomer, which is a unpaired bone. Let's see. I already asked you to compare the male and the female pelvis. There's a couple of questions that relate to that. I also asked you to identify the number of vertebrae in the cervical, thoracic, lumbar region, and I asked you to be able to give me those numbers. There are other conditions as well that you should have a basic understanding or basic knowledge of the definition. Osteomyelitis is an important condition. Osteomalacia is another condition that you should be familiar with. You should know what the role of growth hormone is on the bone. You should know what the role of estrogen, particularly elevated estrogen levels are, what effect that has on the bone. Also, thyroid hormone also has an effect on bone as well. I don't think I asked you a particular question about that, but certainly it's a part of your study and you should be familiar with that. You should be familiar with articulating surfaces of the following. The femur articulates superiorly with what bone? The femur articulates inferiorly with what bone? The tibia articulates superiorly with what bone? The tibia articulates inferiorly with what bone? You should be familiar with the term distal, proximal, medial, lateral. Again, you studied this in the first portion of the exam, and you'll see these terms are used a lot during the examination. You should be familiar with the term fossa, the term sulcus, the term fissure, and the term facet. You should be familiar with the bony structure referred to as the sternum. The sternum has three parts. The sternum also articulates with other bones. You should know those points of articulation. You should be familiar with the bone, the scapula. The scapula. Scapula is a triangular shaped bone. It has several borders. You should be familiar with the borders of the scapula. There are some points of articulation with the scapula. You should know what those points of articulation are. You should be familiar with the maxillary bone and the mandibular bone. There are some important surface features of both of those bones you should be familiar with. And that primarily covers the material that will be on the lecture portion of the exam. I'm going to now share the desktop, and this will allow you to look at some illustrations that I'll kind of go over for the purposes of the lab portion of the exam. Okay, this actually is the slide presentation that is on the lecture portion of your. I'm sorry, this is actually the slide presentation that is on your course, documents under the lab portion of the course. As you can see, these are the various bones of the skull: frontal, parietal bone, occipital bone. Obviously, I'm going to ask you to identify these bones. Also, there's some particular important. I would expect you to be able to identify the external occipital protuberance. And then there are a number of suture lines here as well that you can see that I would expect you to be able to identify. This is an anterior view of the skull. As you can see, the nasal opening, the two nasal bones, paired bones, nasal bones. There are the superior, inferior, and medial conchi or turbinate that are important. You should be able to identify. Should be able to identify the frontal bone. There's a foramen here, a supra and an infraorbital foramen openings. Mental foramen, I would expect you to be able to identify. I asked you on the lecture portion of the exam to be able to identify the alveolar processes, which you can see the dentitia are in. The maxillary and the mandibular bone are important. I believe there's a lateral view that'll show you some points of articulation in just a bit. Inferiorly, there are a number of foramen. I certainly would expect you to be able to identify the foramen magnum. There are a number of other smaller foramen as well. I don't believe I asked you to identify any of those. If you have learned them, that's important, and certainly you'll be able to use that later clinically, those of you who are going into any clinical aspect of healthcare. This is a horizontal section. The top portion of the skull has been removed, and you're looking down into the skull. Again, you can see the opening of the foramen magnum and the occipital bone, lower portion of the frontal bone, the ethmoid bone. You can see the sphenoid bone, which has a very unique look. A very important landmark in the sphenoid bone is the sella turcica. This is where the pituitary gland actually will rest. You can see portions of the temporal bone there as well. These are the various vertebrae of the body. I will expect you to be able to identify some of the features of vertebrae. The vertebral body, for example, the vertebral foramen, the processes that you can see here. There are transverse processes and spinous processes that are located here. Structurally, you will also see that the vertebrae are different when we talk about the cervical vertebrae. As you can see, the cervical vertebrae have a very unique opening called the transverse foramen, actually where arterial and arteries where arteries actually will pass through the bone itself. Very important differentiation. Also, you can see the bifid spinous process of the cervical vertebrae, which is different from the other. Also, you should take time to learn the landmarks and the structure of the atlas and the axis. The atlas, as you can see, is cervical vertebrae 1. The axis is cervical vertebrae 2. The structure, the dens, also referred to as the odontoid processes there, would expect you to identify it. As you can see, there are 7 cervical vertebrae. This illustration is out of your textbook and also gives the features of each of the different vertebrae, the cervical, the thoracic, and the lumbar vertebrae, and you should be familiar with this table. Here's a good picture illustration, again, out of your textbook, of the sacral bone, the coccygeal bone. Should be familiar with their structure. Here's a good picture of the clavicle. Again, there is a medial articulating surface. Medially, you see it articulates with the manubrium of the sternum. You can also see there's an articulating process with the acromion. The acromion process comes off of the scapula, and that's an articulating surface as well. This is a good view of the scapula. As you can see, several processes, coracoid process, acromion process here. The articulating surface with the humerus articulates with the superior end of the humerus at the glenoid cavity. Should be able to identify that landmark. And then the various borders. The medial border, also referred to as the vertebral border. There is also the lateral border. And then, again, you can see a dorsal view of the acromion and the coracoid process. Some long bones. Here is an example of a long bone. This is the humerus. As you can see, as superior end, inferior end, there are a number of different landmarks. I would expect you to be able to identify the difference between the anatomical neck and the surgical neck. Various landmarks, including the deltoid tuberosity, where you see a point of insertion of the deltoid muscle. We'll get into the muscular system in the next test. And then articulating surface inferiorly. The humerus articulates with both the radius and the ulna inferiorly. Should be familiar with those articulating surfaces. This is the ulna and the radius. Notice the various landmarks on the ulna, the olecranon process, which is basically a C-shaped joint. You see the trochlear notch is a portion of the olecranon process. As you can see, the the ulna bone is actually larger superiorly than it is inferiorly, where it gets smaller. In anatomical position, remember that the ulna bone is the medial bone, or it's on the little finger side, and the radius is actually on the lateral aspect in anatomical position. And if you notice the radius you can tell by the circular head, thus the name radius. There's a circular head. The radius is actually smaller superiorly and larger distally. These are the bones of the hand, and I didn't ask you to identify each of the specific carpal bones, but you should know where they are located at and their point of articulation with the radius and the ulna. You should also be able to identify the metacarpal bones. Now, you notice the numbering of the metacarpal bones. Notice that the numbering begins in Roman numerals, and in anatomical position, remember the thumbs are in the lateral position, and the fifth metacarpal is basically in a medial position. And so the number starts with the thumb, so the numbering is going to start laterally and move medially. And that is important, and I will ask you to number those in order. So if you're looking at an anterior view, anatomical position, or if you're looking at a posterior view, anatomical position. So don't confuse that numbering system. These are the bones of the hip, pelvis bones. Again, you can see a number of bony landmarks. This is the iliac crest. Remember, we're talking about three bones here. The ilium, which has the iliac crest, the ischium, and the pubic bone, three bones here. Large foramen here that I would expect you to identify, the obturator foramen. And then, of course, this large articulating surface here, the acetabulum, is a point of articulation of the superior portion of the femur. Should be able to identify the iliac spine, the ischium spine, the prominent pubic tubercle, and should be able to identify these landmarks. This is a good view of the pelvis, anterior and posterior view. Look at the points of articulation here from the sacrum and the pelvic bones themselves. The sympubis, very important point of communication between the two pelvic bones. This is the longest and largest bone of the body, the femur. Again, the femur has a number of anatomical landmarks. Would expect you to identify the greater trochanter, the lesser trochanter, the neck, the articulating surface or the femoral head, the shaft of the bone. And again, you have lateral epicondyle and condyles. You also have medial epicondyles and condyles. This is the patella, pretty straightforward bone. And two bones here in the lower leg, the tibia and the fibula. Should be familiar with those. Recognize that the weight-bearing bone here is the tibia. The tibia actually articulates with the femur, and inferiorly you're going to see it's going to articulate with the talus bone. Notice that the fibula is not a weight-bearing bone. It does not articulate with the femur, nor does it articulate with the tarsal bones that you see in the foot. The only bone that bears weight here is the tibia bone. Here are the bones of the foot. Should be able to identify these key bones as well. Remember, the point of articulation is the talus bone. It articulates with the tibia superiorly. And then you can also see the numbering system here on the feet. Now, the numbering system on the feet is a little bit different. Notice it starts with the great toe, and the metatarsal bone is actually number 1, and that's in a medial position. Remember, the hand in anatomical position, the number 1 metacarpal is actually in a lateral position. But here in the foot, you see that number 1 metatarsal bone is in a medial position, and that's how the numbering occurs, and you should be familiar with those. And then, of course, the phalanx that end that portion of the foot. Okay, well, that ends the material that's going to be covered for the exam, and I hope this helps you to prepare for it. Please go over this information. Remember to do the practice exam. Remember to do the exercises on your course compass. Be very helpful for you, and I hope you do well on the exam. Take care.